Caroline Richany from Lebanon. She is a public health specialist, and we'd love to hear your thoughts from Lebanon. Hi, Caroline, please do unmute. Oh, you're muted. I'm so sorry. Maybe.
It's all right. Hello, everyone. And thank you for presenting me. First, I would like to welcome each and every one of you. And I'm very delighted to take part of this international health event in celebration of International Midwives Day. So I am Caroline Richany, a public health specialist from Lebanon. I have a bachelor degree in public health and development sciences and a master degree in hospital and healthcare management. So our emphasis is on global health, and we achieve global health through different projects, starting on the national level. We work on improving maternal health, child health, and identifying the vulnerable populations in societies. Who are the vulnerable populations? Pregnant women, elderly people, and disabled people, and other categories. So I used to work as a public health specialist with UNICEF. I was an accreditation auditor in order to improve the quality of health programs in primary healthcare centers. So I work at the primary healthcare center level. So first of all, we used to improve the quality of programs that include improvement of maternal health programs for pregnant women and women in general to have access to different services, health services at the primary healthcare centers, and to improve immunization for children. So right now I'm working as a community health supervisor with an international NGO, and our donor is UNHCR. And we are working as relief on a health emergency response after Beirut blast. I think all of you have heard of this tragic event. What I'm working on is right now is the improvement and the awareness of the vulnerable populations and the community health in general in order to have access to free healthcare services at the primary healthcare centers. We work on different levels or on different areas in Beirut, and it is free of cost, and we improve the awareness for females in the age of conceiving a child to be prepared prenatal, antenatal, and postnatal care. So, and we provide vaccination for children for free. We improve the awareness of mothers on malnutrition for their children because malnutrition is a major public health concern. So that's what we do in general. We improve the general health of the women and their children. And in general, we work on the other hand on other vulnerable populations. As I mentioned earlier, on the elderly, we try to prevent non-communicable diseases, and we work as a response for the pandemic in prevention of communicable diseases, and mostly coronavirus SARS-2. So tonight I have prepared a presentation for you. You know that I am a public health specialist, so I wanted to find a link or joint between what we do as intervention of health issues and what do you do, and I really appreciate your great efforts. So I'm sharing right now my PowerPoint presentation. Okay, please, you have disabled that I cannot share my screen. So please, can you enable that? Okay. Okay, so Tonight, I am going to discuss with you an interventional method that is highly important in midwife practice and obstetrician's practice, but has a public health essence. So latency in umbilical cord clamping, which is an interventional method for reduced anemia in neonates and infants. So I'm going to provide you with some epidemiological facts. So 273 million children under the age of 5 years old were anemic, and you know that anemia is one of the major health implications for infant mortality around the world. And you can see that the numbers are very high, and that statistic was taken in 2011 by the World Health Organization, and 42% of them accounted for iron deficiency. I would like to note that iron deficiency is a severe type of anemia, which is mostly reported in children, especially under the age of 5 years old. So in sub-Saharan countries, we can see that anemia was found in 25% of neonates among a study population that showed 48 out of 192 patients or neonates had anemia. And in another study in northern India, 55% of the children between the age range of 1 to 2 years old were diagnosed with anemia. Of course, in Angola and in other countries and underdeveloped countries, especially, we are seeing reports of anemia among the children, and this is increasing the percentages and prevalences of infant mortality worldwide. So the World Health Organization estimates that 50% of anemia can be attributed to iron deficiency in infants, and this is how serious this issue is. So 90,000 deaths, even among neonates, include both sexes, were due to iron deficiency, and it is mostly prevalent in children between the ages of 6 to 12 months. Infants with anemia and severe anemia lead to children with cognitive delays, low psychomotor skills, low IQ, slow learning, short-term memory, slow short-term memory, slow language development. And you can see that these children with anemia have very slower achievements or lower achievements at schools in relevance to other children. So this might be even a problem for the future that might cause different psychosocial issues, you know, like poverty, like unemployment, and so what is umbilical cord clamping? You all know what it is. So the interventional method here is that delayed umbilical cord clamping from 2 to 5 minutes during a childbirth might increase the blood flow and oxygenation of blood, and this will prevent the children or neonates or preterm neonates from acquiring anemia, or specifically iron deficiency anemia. Okay, so in safe-term babies, up to 90% of the blood volume transition occurred during the first few breaths. Recent studies on blood volume, oxygenation, and arterial pressure have shown that the latent umbilical cord clamping within 2 to 5 minutes range of post-birth have many health benefits on preterm and term neonates. And it can also be implemented on both C-sections and vaginal deliveries. Okay. So the effects on latent umbilical cord clamping is compared here on different levels based on age of the child. So on preterm neonates, it regulates the blood pressure, it lowers the need for blood transfusions, lowers the risk of having necrotizing enterocolitis, which is a serious and lethal GI disease for preterm neonates, less risk of life-threatening bowel injury. As for the term neonates, it increases hemoglobin levels, hematocrit levels, ferritin levels, and improves the hematological and circulatory systems. As for infants at older ages, it improves the iron stores in the first several months of life. It showed in different studies and reviews that it is significant, or it is associated with better psychomotor and mental development. It increases ferritin concentrations, especially at the age of 3 to 6 months, and of course, as we said, that it improves the learning and cognitive abilities for the children. So all ranges with delayed umbilical cord clamping during labor showed in recent research to have sufficient iron levels in blood until 1 year of age. So the child stays with sufficient amount of iron in blood due to this delay. Maybe 1 minute delay in umbilical cord clamping might save the baby from anemia, or the child from anemia, until the age of 1 year old. 1 year, yes, 1 year old. So thus prevented anemia, and severe iron deficiency anemia is maintained. So from a personal and a public health perspective, I would like to add my input on this. So latency in umbilical cord clamping should be, of course, highly focused, especially on preterm babies, on preterm neonates, because you know how critical their situation is, and their need for blood transfusions and very low iron levels in their blood. So this delay in umbilical cord clamping might save them and increase their ferritin levels in blood. And in addition, recommendations for mothers, of course, not to forget that we always recommend that mothers breastfeed their children until the age of 6 months, and preferably till the age of 1 year old, in order to get, of course, the sufficient iron quantities from the breast milk as well. And in underdeveloped countries, malnutrition should be a concern when pursuing child health. Therefore, malnutrition is as well associated with anemia among children. So we should prevent that by providing maybe food supplements to these children. And it's their right to have access to clean food, healthy food, as well as for the mothers and those who are breastfeeding. So this is my presentation. These are my references that I have used. I really hope that we increase the collaboration between midwives, especially at the primary healthcare center, because this is where I work, and this is like my field of expertise. So I believe that if we combine the two efforts of public health and the work of midwives, we would improve the experience of childbirth, and prevent different complications, different unexpected maybe, or many complications, you know, that might affect the life of the child or the neonate and even the mother. So thank you so much, and I'm waiting for your questions.
That was fascinating, and actually a topic that we talk about a lot in my office. So it's great to hear you talking about delayed cord clamping.
Yes.
Does anybody have any questions for Caroline? Gail, please, you have a question?
Yes.
I mean, what is the, I guess, what is the standard protocol in the hospitals that you're in? And Dr. Kate, if you say you have much discussion about this, why are you having a discussion about the obvious that midwives have known for 50, 60, 70, 200 years? What is the discussion? So it was a good presentation and good research, but where was intuition?
Okay, so let me reply to your question. So you're meaning that what is the standard for umbilical cord clamping? That is
right. Yes.
Yes. So right now, most of the hospitals around the world are implementing this new standard on on umbilical cord clamping, yet there are still hospitals and institutions that are immediately clamping the umbilical cord. Therefore, I'm raising awareness in order to delay the umbilical cord clamping to 2 to 5 minutes, and not to immediately clamp the umbilical cord, in order to prevent these neonates or children from having anemia. So yes.
Good. Wonderful. Wonderful.
Thank you.
And I think it's
All the women here are wonderful.
It's the same discussions in our office, Caroline. My boss's area of research interest is about delayed cord clamping, especially in low-income countries, especially in preterm babies, and how to promote that practice.
Yes.
Because although there's a very good evidence base for it, it's certainly not practiced everywhere. So something we all need to be talking about.
That's why I'm a public health specialist right here, and I'm increasing the awareness and trying everywhere to spread the awareness in order to have safer practices and to improve child and maternal health. And I want to add that this technique doesn't add any risk to the mother unless there was type of bleeding, maybe abruption in the cord, but other than that, these are very minimal numbers of mothers that had these complications. Otherwise, the majority of mothers had safe childbirth, thanks to you midwives. So yes, we have to delay the umbilical cord clamping.
Perfect. Oh, that's great. Thank you so much. It's such an important message to be really clear about.
Thank
Leila,
you so much.
let me pass back to you to move on to our next speaker.